Don Mazzella here again for Small Business Digest. You know, healthcare is on our minds a lot these days. Some people say it's almost too much on our mind. We should go back to work. But anyway, we have with us today Jason Duprat. He's going to talk about healthcare, burnout, and a few other things. Uh, uh, but first, Jason, welcome to the program.
Yeah, thanks for having me. It's a pleasure.
Jason, tell us a little bit first about your background and then about your company and finally a website.
Yeah, sure. So my background is that of a registered nurse who went back to graduate school and became a registered nurse anesthetist. A lot of people haven't heard of what we do, so we provide anesthesia in the operating room in every state and in most countries worldwide. Some states we practice independently, other states we practice under the supervision of an anesthesiologist physician. And so that is what we do. I spent 10 years in the Navy Reserves, started as a critical care registered nurse, and then transitioned into nurse anesthesia there as well. Just recently left after just about 10 years and resigned as a lieutenant commander in the Navy Reserves. So we have a business called the Healthcare Entrepreneur Academy. And
Jason, do me a
yeah,
favor. Look into the camera because you're looking downwards. People want you to look at them.
yeah, for sure. I didn't realize this was a video podcast.
Oh, yes, very definitely.
Gotcha. Cool. You want me just to start over again?
No, no, keep going.
Okay. So yeah, I run a business called the Healthcare Entrepreneur Academy podcast. I run the podcast and we run the business as well. The business is a training program that helps healthcare professionals learn how to start their own niche medical practices. And so we talk about things like ketamine infusion therapy and IV infusion therapy. And we teach healthcare professionals how to not only learn the clinical aspects of those particular subjects, but we also teach them the business side as well. And so our website, we have a couple of them, but the main website where you can get all the information, including podcasts and courses, is just my name, jasonduprat.com. And that's spelled JASONDUPRAT.com.
Okay. Well, you're here, Jason, because over the last 3 years, we've heard a lot about burnout. We've heard a lot about the changes in the healthcare. What are some of the things you want to talk about here today?
Yeah, so this is just something that's I'm super passionate about in terms of healthcare professionals entering the business space and the entrepreneur space, and it's a massive trend that I've seen really just sort of explode over the last 5 to 7 years, and really there's a multitude of reasons for that. COVID certainly didn't do any healthcare professionals any favors in terms of work hours and stress levels and those sorts of things. But I feel like the healthcare system as a whole has a lot of problems. Our healthcare system has basically become corporatized, and you see small practices getting purchased up left and right, and those small practices become basically consolidated into larger healthcare systems. And so, even going to your primary care doctor, your cardiologist, in most cities now, you're starting to see those small practices being gobbled up by the hospital systems that operate in that practice or in that area. And so, along with the corporatization of healthcare comes a lot of problems, right? Most corporate healthcare entities are now for profits, which is a massive change compared to what it used to be. They used to all be nonprofits. They used to be run by charitable organizations like churches. And now that we have, a situation where profits are extremely important, and some would even argue that they are the most important thing in some of these businesses because they're not just corporate healthcare systems, they are publicly traded corporate healthcare systems. And so anytime you get a publicly traded company, I mean, what is the number one objective of that public company? Is to increase shareholder value. How do you increase shareholder value? Well, you grow and you increase your profit margins. And so as much as we like to see and we want to believe all of these wonderful media advertising campaigns about how everything is, related to, providing the best care for the patient, and that is 100% their focus, or so they want you to believe. You see, as a healthcare provider, many of us, as we see, the situation is much different on the inside, and that's why we have such a massive exodus of healthcare professionals leaving the workforce, leaving the corporate hospital healthcare system, and very interested in starting, their own practices, their own businesses, and they're just completely burnt out and sort of fed up with the corporate healthcare system the way it's operating today.
Okay, I'm gonna stop you right there. And question I ask every health, if it's so bad, why does everybody come here from around the world? I went to the Mayo Clinic, and there are 3 floors in the Mayo Clinic where they have Arabic television because
Mm-hmm.
so many people come from those countries to the Mayo Clinic. It's like I'm just curious. I hear this all the time, but you want to comment on that? I'm putting it on the spot a little bit, but um, we'll get to what you're saying. I'm not
Sure.
disagreeing with you. I'm just curious what your thought is.
Sure. Yeah. So there is such a thing as healthcare tourism, but I would absolutely make the argument that most people are not coming to the United States. Um, the reason that you're seeing, very, culture-specific television channels and very specific, nationalities potentially on certain units or in specific hospitals is because typically certain hospitals will be located in areas that are the surrounding population has that particular population in it, and so of course they're going to have lots of that particular, nationality in their hospital system, and so they're catering to that particular clientele, right? If you go to, for example, I got deployed and worked in the Bronx, massive Hispanic population. Nearly everybody there was Hispanic. It doesn't mean that they're traveling from Hispanic countries to come to the Bronx. And so, if you actually look at healthcare tourism, it's the U.S. citizens that are going elsewhere. Very few are coming here. I've only seen one patient in my entire life as a healthcare professional, and that goes back to 2017. So over 15 years of working in hospital systems, I've only ever come across one patient, and I didn't even have the patient. I just saw them in the unit and heard that they were coming from an international place specifically for treatment. And at the time, it was actually Winnie Palmer Hospital, which was one of the busiest labor and delivery hospitals in the world, and had a phenomenal reputation because they do high volume complex cases. And so there are certainly some people coming here to get healthcare, but it is not in droves by any means. If you look at the U.S. healthcare system in terms of developed countries, it is actually at the very bottom of the list. It's usually bouncing around at the very bottom. It changes every year, but we spend the most per capita on healthcare, over $10,000 per person, and we have the worst healthcare outcomes in terms of infant and maternal mortality and a variety of other things. And so if you look at the data is out there. We just tend to not get that put in our face, right? We could get a lot of promotional materials, a lot of commercials, from corporate hospital and healthcare systems that want to make you believe that we have the best healthcare system, but the research completely says otherwise.
Okay, well, let's talk about entrepreneurship, which is what this program's about.
Hmm.
You're you're helping people, for instance, come out of the system and run their own business, but they eventually have to refer people to hospitals, etc. How does it work when a person decides to go out on his or her own, and then how do they make money?
Yeah, so there's a variety of different business models, right? Like I've seen some nurses start career coaching programs. And so they basically exit the actual care of patients completely. They decide to care for nurses by helping them learn how to progress through the career paths of, the corporate healthcare system potentially, or look at alternatives. I've seen people who are interested in breastfeeding, for example, start lactation consulting businesses where they will go out on their own and help mothers struggling with breastfeeding to navigate those sort of hardships, so that way they can have healthier babies by breastfeeding real breast milk versus formula. There's a massive amount of opportunity in the space, and really sort of how they enter depends on the path that they choose. Now, some certainly healthcare professionals will choose the clinical route. That's actually what we teach in our programs, is mostly geared towards providers and registered nurses who want to start their own practice. They just want to have some more autonomy. They want to have control over their schedule. Certainly, there's opportunities to increase your income compared to some of these really low rates that the hospitals are paying now. And so in that particular situation, they're oftentimes starting mobile practices, they're starting concierge clinics. And so that's sort of how the process looks. It really kind of depends on license type, interests. I've seen and interviewed healthcare professionals on the podcast who have started completely different types of businesses. They've gotten into the software business where there are, for example, I just interviewed a physician who is specialized in obesity medicine. She created a software program with a team of people that helps other obesity specialized clinicians implement their protocols, their plans, and the software to help them follow up with their patients. So there's such a gamut and a variety of things that people can do in the healthcare space. It is absolutely tremendous. And I see that every single day just because that's the space that I'm in. And there's so many phenomenal examples of healthcare professionals starting their own businesses and doing it very successfully.
Your website for people who want to learn more?
Yeah, jasonduprat.com is where you can learn about the podcast, which is where, I give technical business advice. It's also where I interview healthcare professionals who are in the healthcare business space, and also where we have our course information. Yep.
Okay. So now let's continue onward. I'm like you, and a how do you say it? And it's a nurse with a specialty, and I decide I don't like working at the hospital.
Mhm.
I come to you, and what do you do?
Yeah, so we help physicians, nurse practitioners who there's a variety of different specialties. There's family nurse practitioners, there's clinical nurse specialists, there's acute care nurse practitioners, there's gerontology nurse practitioners. Me particularly, I'm a nurse anesthetist, so we specialize in the provision of anesthesia. And so we help all of those types of professionals and others learn how to start their own medical clinics. And it could be mobile or it could be, a brick and mortar type of practice. And so we help them walk through and understand their scope of practice, which is a big thing to consider if you are a non-physician. So physicians are obviously they have the most training. They have about another year to 2 years of training and experience over a nurse practitioner. And so they have a broader scope of practice. They're allowed to do more things, provide more services and different types of care, for example. And so if a nurse anesthetist came to me and said, "Hey, I want to do, for example, Botox," we would help them navigate their scope of practice to determine if, in their particular state, they're allowed to create an aesthetics practice and provide those types of services under their license type. And the interesting thing is that in most states that don't have corporate practice of medicine restrictions, anybody can start a medical practice. It doesn't matter what type of license you have, but if you're providing care to the patient, you just have to make sure that you're doing that in a way that you are abiding by what you're allowed to do, which is also known as your scope of practice. So that's what we help them navigate, among a large variety of other things.
Well, for instance, we're here in New Jersey right at the moment, and if you go to Florida, you can walk in and get a test at a facility. But here in New Jersey and New York, you have to have a doctor's prescription to do anything.
Hmm.
Um, uh, um, are there certain states that are more attuned to letting people be more entrepreneurial?
So certainly there are states like Florida is a phenomenal state. There are no corporate practice of medicine laws, and just to get into that just briefly, basically corporate practice of medicine laws, they're well intended, but they don't often work that well. The whole idea is to keep the corporations from controlling how a physician or a healthcare practitioner practices and interacts with their patients. So they can't tell a doctor, for example, you need to run XYZ test on this patient, or you need to prescribe this medication. So that's the intent of the corporate practice of medicine laws. And so those states that have those types of laws, they prevent oftentimes non-licensed healthcare professionals and sometimes very specific license types from entering, or from creating a business that is going to involve direct patient care. And so, yeah, the best states to start in, especially for nurse practitioners. I mean, you can go to the National Council on the State Boards of Nursing website. It has a list of all the independent practice states, which is now over 50% of the states allow nurse practitioners to practice without physician supervision, because all the data out there shows that the care is nearly identical. It's statistically insignificant, the differences. And so a lot of because of the healthcare shortage, the healthcare provider shortage, a lot of legislators are starting to realize that, hey, we need to improve our population's access to healthcare. And so, what's a great way for us to do that? Well, it's allowing nurse practitioners, these advanced practice registered nurses of a variety of different specialties, to practice without having direct physician supervision. Because oftentimes, if you see that type of scenario, in a lot of states, the physician doesn't even have to be present anyways. It's kind of all, it's all for essentially for show. I mean, sometimes the physician, and it depends on the scenario, but if the minimum level of involvement only requires, no chart reviews, only that they basically are put on the website and are available for consultations if needed. I mean, that's not really a cost-effective, way to deliver healthcare, because it just adds another layer of provider that has to be paid. So there's a lot that goes into it. Once you start to see, there's politics obviously involved. There is scope of practice that's involved, and it can get very complicated when it comes to trying to start a business where clinicians are trying to provide that direct care to patients. But if they're trying to go elsewhere, for example, like for us, the Healthcare Entrepreneur Academy, we saw a huge need because I actually started my own practice and it was doing very well. We had healthcare professionals from all around the country calling us to say, hey, I really want to start my practice. How do I go about doing this? And so that's sort of how our whole business was born, is helping those clinicians navigate those processes. And like to this date, we've already helped many hundreds of clinics open by nurse practitioners and physicians alike. And so it's a very exciting time to be in this space right now, because just a few years ago there was no one in this space helping healthcare professionals learn what they need to learn in order to safely start their own practices and start providing care. So that's kind of the challenge that we took on. And the proof is in the pudding in terms of the demand, because we are growing at nearly 100%, doubling almost year over year over year in terms of the number of clients we're seeing and helping, because they're just completely fed up with the healthcare system the way it is today. They don't have the autonomy, they don't have the salaries are pretty darn stagnant. For example, when I was working as a registered nurse, after my first year of working as a registered nurse, I got the whopping pay raise of 34 cents. I mean, that's basically a slap in the face to a healthcare professional who is working so hard day in and day out to make these hospitals a heck of a lot of money. To get a 34-cent raise is really just not appropriate. And so for that and many other reasons, healthcare professionals are looking for alternatives where they can earn more, they can have more autonomy, they can be more in control of their environment, their future, and and it's working. We have a lot of really happy healthcare professionals that are starting businesses right now.
Um, your website again before I ask the next question.
Yeah, so our website again is jasonduprat.com, and that's where you can learn about all of our training programs, our podcast, and stuff. Yep.
Okay. Jason, a politician here in New York said that one of the reasons they didn't do it is because too many people will then be able to write prescriptions, and thus leading to towards more uh, fraud in the prescription writing environment. What do you say to that?
Um, I would guess my first question would be the reason they didn't do what? Like open up who can get prescriptions, who can
Yes.
write prescriptions? Okay.
Yeah,
Mhm.
obviously, if a nurse practitioner sees, a nurse practitioner can write prescriptions, but if you're going to business, um, you're expanding the number of people that need to write prescriptions. So his argument was that doing that loosen the ability to control writing prescriptions.
So certainly there are prescriptions that absolutely 100% positively need a licensed healthcare professional to evaluate the patient to make sure that it's safe, because some of the safety profiles of these medications, although they've made it through the FDA process, they have some very serious and significant side effects. And so there has to be some sort of checks and balances system there. But when it comes to, sort of expanding who can do that, really, first thing in politics, you always got to follow the money and see who the donors and supporters are, because there's a lot of turf protection in the healthcare space. Something I had no idea even existed until I started in my anesthesiology program, and so there's a lot of influencers behind the scenes that have very big pockets and a lot of power and influence, and they can affect different laws from being implemented or not implemented. And so, first of all, I would say start there. You see a lot of turf battles in the healthcare space, and it's usually, I'll just call it like it is, it's usually physicians versus nurse practitioners, physicians versus physician assistants, who are now called physician associates. And so, basically, these other programs that are non-physician programs, non-MD, non-DO, are basically increasing their educational requirements, right? Now they're getting to the point where they're getting very, very close to the same educational requirements as a physician. Most of these programs have all changed to mandatory doctorate programs. They've got clinicians with thousands of hours of training. And so physicians oftentimes, or physician groups, or physician organizations will see this as a threat to job security and to salaries for those professionals. And so I would say take a deep look at that, who's funding those particular politicians, because you'll see that the physician lobby, and I don't really like to get into the politics too much personally, but this is just a fact of the matter. The physician lobby is very, very powerful, and it's something that's extremely pervasive, especially in the anesthesiology space, right? Because they're seeing nurse anesthetists now. Their nurse anesthetists in the military are completely independent practitioners. They have no supervision whatsoever. They practice on the front lines of the battlefield. They run the entire anesthesia departments in the hospitals and frontline systems. And so the anesthesiologists in particular, very aggressive against nurse anesthetists, because they see us as completely competent and able to take their job, and their much higher salaries, or at least potentially bring their salaries down. And so that's where a lot of this comes from, unfortunately. But that's just how it is. And so Americans and America in general don't have access to a lot of the medications that you see, for example, in Europe. So my brother-in-law is a pharmacist in Europe, and my wife is from Romania, and so he has been working as a pharmacist for about 5 years now, and so he can actually get and prescribe and administer a variety of medications that pharmacists can't basically do anything besides like a flu shot. I mean, who's better qualified to, or who's very qualified to prescribe a medication. I think a pharmacist is really incredibly qualified, especially now. Again, they have doctorate degrees mandatory in pharmacy. They're all PharmDs. So they've got extensive training on drugs, their side effects. Yet, for some reason in the U.S., a pharmacist can't administer or prescribe a medication, even the simplest of medications, to somebody who comes in, just seeking, for example, an antibiotic or something other than a vaccine. It's kind of mind blowing if you go to other countries and see how they operate. A lot of the prescriptions that we have here aren't even regulated at all. They're non-prescription medications in other countries, and so that has a lot to do with the turf battles that happen with pharmaceutical companies wanting to generate maximum profit. Like there's a whole lot that goes into it. But that's just one example of the differences between US versus Europe.
We only have a minute left. What would you like to leave our audience with?
Yeah, so I would like to leave the audience with, if you're a healthcare professional, even if you're not a healthcare professional, there's 40 some states where non-healthcare professionals can start businesses in the healthcare space and directly providing patient care. Now, you just obviously have to hire the healthcare professionals or partner with them to start these types of medical practices. And again, there's a bunch of other things that you can do that are directly providing care, for example, or services, for example, to clinicians who are delivering the care. So the software is a perfect example. All these supportive services that are in the healthcare space, but not involving, providing direct care to patients, are opportunities that are well worth exploring. I mean, the GDP in the healthcare industry is 17%, 17% of GDP. It's in the trillions of dollars a year. And so there's opportunity everywhere in the business space related to healthcare. And it's just a matter of pursuing something that you're interested in. If you're a software guy, you could take the software route. If you're a clinical professional, you could take the clinical route. The opportunities are just endless.
On that note, Jason, we have to say thank you for a very interesting time together. Thank you.
Yeah, my pleasure, Don. Thanks for having me.